Hey, Dr. Kenneth here, board-certified urologist practicing in South Carolina. Today I want to talk about 3 reasons to get a penile implant for the treatment of erectile dysfunction. First, what is a penile implant? A penile implant is a surgically implanted device intended for the treatment of erectile dysfunction. Most men who get a penile implant have not responded to oral medications, and some men have tried penile injection therapy as well. An unfortunate message that many men have heard is that a penile implant is a last resort, giving the impression that this is not a treatment that you ultimately want to pursue. I'm going to give 3 reasons today that I think this last resort message is unfortunate and really needs to be negated by people who know how to perform penile implants well. The first is very high satisfaction rates with penile implants. So this has been shown again and again in survey studies who look at patients who've had a penile implant, and that is ultimately what is their satisfaction associated with the procedure. Most studies show that penile implant satisfaction exceeds 95% for the men undergoing the procedure. This is an extraordinarily high satisfaction rate for an elective procedure. Just as important as the implant satisfaction for the patient would be partner satisfaction, and partner satisfaction is at least as high as patient satisfaction. The second reason to get a penile implant is restored confidence in the ability to perform. So many men who have had erectile dysfunction for a long time essentially accept it as part of their life. They lose their libido often because they don't want to set themselves up for disappointment by attempting intercourse when they ultimately don't believe they can perform. So the implant is a guaranteed firm erection every time. The man doesn't have to worry about if he's going to be able to perform or about the quality of his erection. So for this reason, many men have restored confidence and interest in sexual activity after getting a penile implant. The third reason is that it is a long-term solution. So pills and injections, while appropriate for many patients, ultimately are not a long-term solution for erectile dysfunction. A penile implant is a long-term solution in that this implanted device has great durability and usually lasts between 12 and 15 years in most studies. So this device allows for the creation of a confidence and allows for a long-term solution because you're not carrying pills or injections with you. You don't have to worry about, hey, did I go to the pharmacy to get my supplies? This long-term solution lets you know that you will be able to perform. So these are 3 great reasons to get a penile implant. If you're affected by erectile dysfunction, especially if it's not been responsive to oral medication, absolutely have a discussion with your urologist to see if this might be an appropriate treatment for you. To help you find a urologist in your community who has expertise in this area, I'm going to put a physician finder from both Coloplast and Boston Scientific who make the implants in the comment section below. I hope this video was helpful. If it was, please like and subscribe and turn on notifications so that you can see future content as it is released.